Have you ever looked at your pill organizer and wondered if all those medications are playing nice together? Maybe you've noticed you're feeling more tired than usual, or your stomach's been acting up, and you can't figure out why. If you're over 70, those little pills you take every day could be working against you in ways you never imagined. As we age, our bodies change. Our kidneys and liver don't process medications the way they used to, and mixing certain drugs can turn a routine prescription into a serious health risk. I'm not here to scare you, but I am here to help you stay safe and feel your best. In this video, we're diving into 4 dangerous medication combinations that doctors warn against after age 70. By the time we're done, you'll know exactly what to watch out for, how to spot the warning signs, and what to ask your doctor to keep your health on track. Let's get started with the first combination you need to avoid. One of the most common mistakes I see is mixing blood thinners like warfarin with non-steroidal anti-inflammatory drugs, or NSAIDs like ibuprofen or aspirin. Now, I know what you're thinking. Ibuprofen's just something you grab for a headache or achy joints, right? It's over the counter, so it must be safe. But here's the thing. When you're over 70, your body doesn't handle these medications the same way. Warfarin is prescribed to prevent blood clots, which is critical if you've had a stroke or have atrial fibrillation. It works by slowing down your blood's ability to clot. NSAIDs, on the other hand, can thin your blood even more and irritate your stomach lining. Put them together, and you're at a much higher risk for internal bleeding, especially in your stomach or intestines. I had a friend, Mary, who was 72 and taking warfarin for her heart condition. She'd pop an ibuprofen whenever her arthritis flared up, thinking it was no big deal. One day, she started feeling dizzy and noticed her stools were dark, classic signs of a gastrointestinal bleed. Thankfully, she got to the doctor in time, but it was a wake-up call. The scary part? A study from the American Journal of Medicine found that older adults taking blood thinners with NSAIDs are twice as likely to have a serious bleeding event. So, what can you do? First, talk to your doctor about safer pain relief options. Acetaminophen, like Tylenol, is often a better choice for minor aches, but even that needs to be used carefully. Second, always check with your pharmacist before taking any over-the-counter meds, even something as common as ibuprofen. They can double-check for interactions with your prescriptions. And finally, keep an eye out for symptoms, like unusual bruising, dark stools, or feeling lightheaded. If you notice any of these, don't wait. Call your doctor right away. Now, let's talk about another risky combination. Certain antidepressants, like SSRIs and diuretics, often called water pills. If you're taking something like sertraline or fluoxetine for depression or anxiety, and you're also on a diuretic like furosemide or hydrochlorothiazide for high blood pressure or heart failure, you need to be extra cautious. Here's why this mix can be trouble. Diuretics help your body get rid of excess fluid, but they can also lower your sodium levels. SSRIs, which are commonly prescribed to seniors for mood disorders, can sometimes cause a condition called hyponatremia, where your sodium levels drop dangerously low. When you combine the two, that risk skyrockets. Low sodium might not sound like a big deal, but it can make you feel confused and weak, or even lead to seizures in severe cases. I remember chatting with a neighbor, Tom, who was 74 and started feeling foggy and unsteady on his feet. He thought it was just old age creeping in, but it turned out his sodium levels were off because of this exact combination. His doctor adjusted his medications, and within weeks, he was back to his sharp, joking self. The key here is communication. If you're on both an SSRI and a diuretic, ask your doctor to monitor your sodium levels regularly, especially when you first start or change a medication. You can also watch for signs like headaches, nausea, or feeling unusually tired. And don't be shy about speaking up. If something feels off, tell your doctor. They might need to tweak your dose or try a different medication altogether. As we're thinking about these combinations, it's worth mentioning that not every medication mix is obvious. Sometimes it's the drugs you've been taking for years that start causing problems as your body changes. That's why staying informed and proactive is so important. Let's move on to another dangerous duo that's all too common for folks over 70. And trust me, you'll want to pay close attention to this one. Let's dive into the next dangerous medication combination that can sneak up on you after 70. Mixing benzodiazepines, like lorazepam or diazepam, with opioid painkillers, such as oxycodone or hydrocodone. Now, I know these medications are often prescribed for very real issues: benzodiazepines for anxiety or sleep problems, and opioids for chronic pain, like from arthritis or surgery recovery. But when you put them together, it's like pressing the brakes and the gas pedal at the same time in your body. Both of these drugs slow down your central nervous system. That means they can make you drowsy, slow your breathing, and cloud your thinking. In older adults, this combination is especially risky because our bodies take longer to clear these drugs from our system. The result? You could end up with severe drowsiness, confusion, or even a life-threatening condition called respiratory depression, where you're not getting enough oxygen. I had a cousin, Helen, who was 76 and dealing with back pain from a fall. Her doctor prescribed an opioid for the pain and a benzodiazepine to help her sleep. She started feeling so out of it that she fell again, this time breaking her hip. It was a tough lesson, but her doctor later explained that the combination was likely to blame for her foggy state. Studies back this up. A report from the CDC found that older adults taking both benzodiazepines and opioids are at a significantly higher risk for falls and hospitalizations. So, what's the fix? First, if you're on both, talk to your doctor about alternatives. For anxiety, non-drug options like relaxation techniques or cognitive behavioral therapy can work wonders. For pain, physical therapy or even acupuncture might be worth exploring. Second, never take these medications together without a clear plan from your doctor, and even then, ask if it's necessary. And finally, watch for warning signs like feeling overly sleepy, having trouble concentrating, or feeling short of breath. If any of those pop up, reach out to your healthcare team right away. You deserve to feel clear-headed and safe. Now, let's shift gears to another combination that's surprisingly common and just as risky. Taking certain diabetes medications, like metformin, with proton pump inhibitors, or PPIs, like omeprazole or pantoprazole. If you're managing type 2 diabetes, metformin is probably a familiar name. It's one of the most prescribed drugs for keeping blood sugar in check. PPIs, on the other hand, are often used for acid reflux or heartburn, which a lot of us deal with as we get older. At first glance, these two don't seem like they'd cause trouble together, but here's the catch. PPIs can reduce the amount of vitamin B12 your body absorbs, and metformin already makes it harder for your body to take in B12. Over time, this double whammy can lead to a B12 deficiency, which is no small thing. Low B12 can make you feel exhausted, cause tingling in your hands and feet, or even mess with your memory. I remember talking to a friend's mom, Dorothy, who was 71 and kept complaining about feeling off. She was forgetful and her legs felt wobbly. Her doctor ran some tests and found her B12 levels were dangerously low, likely because she'd been on both metformin and omeprazole for years. The good news? Once she started B12 supplements and her doctor adjusted her medications, she felt like a new person. The lesson here is to be proactive. If you're taking both of these drugs, ask your doctor to check your B12 levels at least once a year. You can also talk about whether you need that PPI. Sometimes lifestyle changes, like eating smaller meals or avoiding trigger foods, can help with reflux. And keep an eye out for symptoms like fatigue, numbness, or trouble remembering things. Those could be your body's way of waving a red flag. As we're piecing together this puzzle of medication safety, it's clear that what worked for us in our 50s or 60s might not be the best fit now. Our bodies are always changing, and staying one step ahead means asking questions and listening to what our bodies are telling us. There's one more critical combination we need to cover, so let's keep going and make sure you're armed with all the info you need to stay healthy and strong. And let's wrap up our conversation about dangerous medication combinations with one that's all too easy to overlook. Mixing statins, like atorvastatin or simvastatin, with certain antibiotics, such as erythromycin or clarithromycin. If you're taking a statin to manage your cholesterol, and many of us over 70 are, you're doing something great for your heart. Statins help lower bad cholesterol and reduce the risk of heart attacks or strokes. But when you pair them with certain antibiotics, which you might get for something as common as a sinus infection or bronchitis, things can get dicey. These antibiotics mess with how your liver breaks down statins, causing the drug to build up in your body. That buildup can lead to a serious condition called rhabdomyolysis, where your muscles break down and release harmful substances into your blood. It sounds scary, and it is. Symptoms include muscle pain, weakness, and even kidney damage in severe cases. I knew someone, George, who was 73 and had been on a statin for years without issue. He got a prescription for clarithromycin for a chest infection, and within days, he was struggling with muscle aches so bad he could barely get out of bed. His doctor caught it early, switched his antibiotic, and stopped his statin temporarily, but it was a rough few weeks. Research from the Journal of the American College of Cardiology shows that older adults on this combo have a significantly higher risk of muscle and kidney problems. So, how do you stay safe? First, always tell your doctor about every medication you're taking, even if it seems unrelated. They might choose a different antibiotic, like azithromycin, that doesn't interact with statins. Second, if you start a new antibiotic while on a statin, ask your pharmacist to double-check for interactions. And third, pay attention to your body. If you notice unusual muscle pain, dark urine, or extreme fatigue, don't brush it off. Get in touch with your doctor right away. Being proactive can make all the difference. As we've walked through these 4 dangerous medication mixes, blood thinners with NSAIDs, antidepressants with diuretics, benzodiazepines with opioids, and statins with certain antibiotics, it's clear that staying healthy after 70 isn't just about taking your pills on time. It's about understanding how those pills work together and speaking up when something doesn't feel right. You don't need to be a doctor to protect yourself. You just need to ask questions and listen to your body. Maybe it's scheduling a chat with your pharmacist to review your medications, or asking your doctor if there's a safer alternative for pain, sleep, or reflux. Small steps like these can help you avoid big problems down the road. I know it can feel overwhelming to keep track of all this, but you're not alone. Your healthcare team is there to help, and so is this community. If you've ever had a scare with a medication mix or found a tip that worked for you, drop it in the comments below. I'd love to hear your story, and I bet others would too. It's through sharing that we all learn and grow stronger. Before we go, I want to leave you with a reminder. You're doing an incredible job taking charge of your health. Every day you make choices to feel better and live fuller is a win. If you found this video helpful, give it a thumbs up. It helps us reach more people who need this information. And if you haven't already, hit that subscribe button so you don't miss out on more tips to keep you thriving at any age. Here's to feeling your best, staying safe, and enjoying every moment of this beautiful life. I'll see you in the next video. As we've walked through these 4 dangerous medication mixes, blood thinners with NSAIDs, antidepressants with diuretics, benzodiazepines with opioids, and statins with certain antibiotics, it's clear that staying healthy after 70 isn't just about taking your pills on time. It's about understanding how those pills work together and speaking up when something doesn't feel right. You don't need to be a doctor to protect yourself. You just need to ask questions and listen to your body. Maybe it's scheduling a chat with your pharmacist to review your medications, or asking your doctor if there's a safer alternative for pain, sleep, or reflux. Small steps like these can help you avoid big problems down the road. I know it can feel overwhelming to keep track of all this, but you're not alone. Your healthcare team is there to help, and so is this community. If you've ever had a scare with a medication mix, or found a tip that worked for you, drop it in the comments below. I'd love to hear your story, and I bet others would too. It's through sharing that we all learn and grow stronger. Before we go, I want to leave you with a reminder. You're doing an incredible job taking charge of your health. Every day you make choices to feel better and live fuller is a win. If you found this video helpful, give it a thumbs up. It really helps us reach more people who need this information. And if you haven't already, hit that subscribe button so you don't miss out on more tips to keep you thriving at any age. Here's to feeling your best, staying safe, and enjoying every moment of this beautiful life. I'll see you in the next video.